Hi, it's Sandy Laura Cremers, and I want to speak to you today about dry eyes. The issue that we're all noticing around the world is a lot of people are starting to notice their eyes, whether it is foreign body sensation, pain, itching, tearing, which is really reflex tearing, or kind of redness, irritation, dryness. Much of these symptoms are due to something abnormal on the surface of the eye. So I want to go through some of the causes of that and the treatments. And this is a lot of information, so please forgive me, bear with me. We want to try to cover as much as we can in a short amount of time so you can understand what is going on with your eyes. So spending some time with me during this video will help me be able to answer your questions when you come to see me one-on-one. So as many of you know, screen time is probably one of the biggest culprits of dry eye. We know that aging is a factor, genetics is a factor. If you're Caucasian, or even if you're not Caucasian, there's something called Ocular Rosacea, which is a gene from Europe that for some reason increases a molecule called VEGF, vascular endothelial growth factor. And we can even see it under the microscope that can lead to more irritation. Rosacea patients tend to attract certain mites called Demodex. So those are key factors that we see in our practice every day. Contact lens use is a risk factor. Previous refractive surgery like LASIK or PRK is a risk factor. Having used Accutane or Retina A or hormones, birth control, those are also risk factors. So what we try to do is to find out over time what are your risk factors and what's your prognosis. And so one of the key ways we determine prognosis is based on meibography. And I think some of you have seen your own meibography, and hopefully I have my meibography here. Here it is. So I've showed this in some videos before. This is the way a normal eyelid should look with these white looking piano keys that are filled with oil. And when somebody has any type of scar tissue or a loss of one gland, we treat it as an urgency because we've seen a lot of patients coming in with a loss of glands. This is very important because the more gland, the oil that's gone, the harder it is to get rid of the symptoms. So the way we treat dry eye is two paths. And you've heard me say this before. The most important path is to save these glands. The second is to get rid of your symptoms. But the treatments for each sometimes don't overlap. And so we want to go through that with you. So there's really three categories in terms of saving the glands. The most important is the warm compress routine and the cleaning, like you've heard me talk about in my previous videos. The heat is the only natural way to open the orifice of this oil gland, and the heat tries to melt the oil a bit so the oil can pump out as you blink. So along those lines, things like blinking, every time you wash your hands, wash your eyes. The studies say heat twice a day, 15 minutes. It can be cold heat, it can be warm heat, wet heat, or dry heat, but heat is really what does it. I personally prefer a moist, wet heat, so I use, like at work, I'll take a towel, or even a paper towel, heat it up in a towel like this, and when I'm at the computer, I'll do this, with one eye and then the other eye, or every time I wash my hands, I'll wash my face. So that's the first way. And so some people will use a face steamer, some people will use the Wizard dry eye goggles that are pad that plugs into your USB. Some people use hot potatoes, some people use hot tea bags, or a sock with rice heated up in the microwave, brooder masks. All these things are trying to get people to do these warm compresses to get the oil to pump out. So this oil gland is not too different from a cow's milk gland. If you don't milk it, it's going to dry up, and that's what we've been seeing. If you don't milk it, generally with time and aging, this can occur. Not in everybody, but it can. And so it is much harder to return an oil gland than to save an oil gland. So the first most important way to save the gland is the warm compress routine. The second is LipiFlow, or any type of thermal pulsation. LipiFlow is the oldest one, so that's why we mentioned LipiFlow, but now there's Eyeluxe and other types of thermal pulsations. There has not been a head-to-head study among all of them. LipiFlow has been around the longest. It's FDA approved. That's the one we're familiar with here, but I suspect any of them will work. To kind of get that oil pumping. It's recommended at least once a year if there's any eye gland issues. It's recommended twice a year in people that do not have time to do the warm compresses. Heat can make redness, itching, burning, not burning so much, but itching, pain, and inflammation worse, or redness, because that's what heat does. But heat is the only way we know to get that orifice to open up like a pore and get the oil to come out. So if you feel worse with the heat, and we have some patients that say they feel worse with the heat, you put cold ice packs on the eye or cold water afterwards. Heat first and then cold afterwards. Cold is for itching, swelling, redness. So if your eyes are really swollen in the morning just from aging, or maybe having too much salt in the evening, or you've had a bad night's sleep, or your eyes are swollen from allergies, cold is what we use, but always heat first to get the oil to pump. So that's the second way to save the glands, is the lipoflow. The third category is IPL or probing. IPL and probing are not FDA approved. They're more experimental. We've had many papers on them that they do work. IPL stands for intense pulse light. It's basically a light that goes across the eyelid. It has been used for years for rosacea, wrinkles, and things like that. And what was noted is that when the light went really close to the eyelid and we expressed the oil came out faster, easier, more liquidy, or it could come out more easily. And that was Dr. Toyos who found that. So it does work. And I've had many patients that do have IPL on an occasional basis, or sometimes even monthly. The issue with IPL is that it has to be done usually over 6 to 8 sessions. We here do treat the upper lid. We put a metal contact lens usually on the eye, on the surface of the eye, to protect the cornea and the iris. And we apply this treatment, which is not very uncomfortable with the first part. It's the second part, the expression. We videotape the expression so patients and as well as us can follow how the oil is coming out. And you can see the oil coming out, and it should be coming out like olive oil. The downside is the cost. It's not covered by insurance, and it is not comfortable. And then probing is where we go into each gland, trying to break open any scar tissue, and sometimes we'll insert either autologous serum or steroid or a patient's own platelet-rich plasma. We've even inserted stem cells, trying to regrow the glands. We know the glands can regrow. It's just a matter of what combination of those products need to be applied to get that gland to regrow. We don't know if probing is enough. We don't know which one's better in terms of inserting steroid, autologous serum, platelet-rich plasma, stem cells, or now even cord blood serum. We know it's possible. We're just trying to figure out how can we regrow the glands. But probing is uncomfortable. It can be a very expensive procedure. It is not fun. It is not FDA approved. So our goal is to save those glands. So that's all we have to save those glands currently. And so any patient that has any gland abnormality or any gland loss, I do recommend the thermal pulsation. And in our case, we do tend to recommend lipoflow to kind of save those glands at least once a year, if not twice a year. Now, the second path is to get rid of the symptoms. And many of you have seen my stepladder sheet, which still has all the treatments in the world that I know of, in the whole world. These are all the tools for your toolbox. And so we basically work as a team to try to figure out which one you're gonna like and which one's gonna work. Some people will have an allergic reaction to some of these products, so we want to know about it and we don't use it again. Some people don't feel better with some of these products. Some people feel worse. It's rare to have a problem with one of these in terms of an infection or something like that, but we want to try the least invasive, the least expensive thing first and then move up the treatment ladder. So what we do first is, of course, the warm compresses. There's many ways to clean your eyes, like I mentioned. I personally like tea tree oil. That's my favorite. So diluted tea tree oil, and there's a video we posted on how I use tea tree oil. But now there's over-the-counter products. You can get them on Amazon. There's Avid Nova spray. There's one called Acusyn. Basically, these ideas are trying to basically kind of kill the mites and bacteria that we all get from time to time on the surface of the eye to basically keep the orifice open so the oil can come out. There's things called Blef Scrub, Blef X. There's now something called Eyeluxe. I just posted on my Facebook channel, just trying to basically get rid of this bacteria that we all will accumulate from time to time so it does not clog the oil glands. So that's something to consider as well. Number 2 on the sheet is the diet. So we still recommend omega-3, 2,000 to 4,000 milligrams a day. It's still controversial. There's some papers saying it helps, some saying it doesn't help. We think it does help. It's going to take probably years before a great randomized controlled study shows that it's effective. And I suspect in some patients it's more effective than others. It doesn't seem to do any harm as long as the patient checks with their doctor if needed. And it's basically oral intake of omega-3, which can be fish oil, it can be chia seeds, flax seeds, wild salmon. There's many natural ways to get omega-3. Of course, there's different pills. The only one that I could find that had a publication to its name was PRN, but the paper was published by PRN. We do recommend Udo's oil, and I use Nature Made, so there's various products for that. I do still recommend a low inflammatory diet because a lot of the time the scar tissue we're seeing, this is what scar tissue looks like in the gland. So these dark spots are scar tissue. That's what we believe that is. And that's inflammation, from inflammation. So a low inflammatory diet, ideally a gluten-free, sugar-free diet, I think is ideal, but we cannot say it's medically necessary at this point because there's really not much in terms of randomized controlled studies, and that will take a long time to get. So number two, I tell patients none of these are really randomized controlled proven, but they're anecdotal things that patients have told me have really helped them. So something called Xena dry eye glasses. So when you're at the computer, it looks like glasses, but it's closed off to keep the moisture in. Moisture chamber glasses, personal humidifier, HEPA filter, wraparound sunglasses. Some people swear by taking turmeric and other anti-angiogenic spices, different things. Just read through that and see. The key component of this is to let me know if you have any dry mouth or joint issues, any backache, joint issues, dry mouth, any burning all over your body, your face looks up like it feels like it's burning. We're always looking to see if autoimmune disease is underlying your symptoms. My patients that have autoimmune disease generally tend to come in looking kind of like this. My patients that have Accutane sometimes will look like this, but will be miserable. So we do want to know about those things, your history of Accutane use and your history of dry mouth and arthritis. The third is artificial tears. Most of you know about that. They're basically artificial tears. We recommend preservative-free. If it has a preservative, we have studies saying preservatives can damage cells if used long-term. That has a positive and negative. It helps with the symptoms, but potentially it could cause damage. So preservative-free is the best. They come in, unfortunately, in these tiny little containers. They're very frustrating to use. I tell patients to open it up, put it in a Ziploc bag, keep it in a cup in the refrigerator so you can reuse it till it runs out. I think Fresh Coat has come out with one recently that I think comes in a bottle that is preservative-free. It says here, the reason why preservative-free is best is because of the preservative. The reason why it comes in those tiny little containers is because of the risk of infection. So any drops we ever recommend, even over-the-counter artificial tears, you should never get worse. You should never have a gooky kind of discharge. If you do, you come in and you let us know. So there's many options. The only one that was studied in a randomized controlled study without drug company money was done at Harvard many years ago. It showed Retain was the best, and this is over the counter, but some patients can't stand Retain and they prefer something else, vice versa. So it's a hit or miss, frustrating situation, but try what works for you. Gels are also good, preservative-free. Gels and thicker drops, if it says omega-3, those are lovely, but it can blur your vision a little bit. So you'll have to experiment to see which one you want to use when. If you want to use one in the morning before you go driving, you're not going to want to use a gel or a thick drop. If it's in the evening, you're not going to be driving anymore, you can use a thick drop. And so think about which ones will work for you. There's things such as liposomal sprays as well, and there are also things like Lacrocert that can be used to see which one will make your eyes feel better. The fourth is basically the 2 prescription drops for dryness. These are 2 FDA-approved drops for dryness. The first one to come out was Restasis. It looks like this. It's fallen out of favor a little bit because of some studies that came out that indicated that they were not as good as placebo in some other studies around the world, like in Australia and I think in Canada. It was approved in the United States by the FDA, but it takes about 3 months to really kick in. So we do have patients that love it, cannot live without it, but we have other patients say it did nothing. We have a patient that had stem cell procedure where Xiidra didn't do anything before, which is the next one I'll talk about, and then after the procedure, the Xiidra started working. So we can't explain why in some patients Xiidra works better or Restasis works better, but if your insurance will cover it, definitely give it a try. The next one to come out was called Xiidra. This is basically an LFA2 inhibitor. Here's on my sheet, and it's anti-inflammatory, so LFA1 inhibitor. So these are basically anti-inflammatories. This one was approved for symptoms and signs. The Restasis was just approved for symptoms. And what that basically means is that we believe the Xiidra is a little bit more effective in symptoms and signs in terms of what we see under the microscope in terms of dryness, which has a particular name called SPK, which stands for superficial punctate keratitis. It means there are clear signs that the cells on the surface of the cornea are disappearing because of dryness. Or one called PEE, which stands for basically epithelial erosion. So just be aware that that's what we mean when we say there's signs of dryness. The Xiidra does take about 3 weeks to kick in. I've had some patients have an allergic reaction. Some patients cannot stand the metallic taste, in which case we'll put a punctal plug. Even though the initial FDA approved studies did not evaluate patients that had punctal plugs put in with the Xiidra, you can do that. So I'll explain what punctal plugs is in just a moment. So the whole point of this entire sheet is trying to keep people away from the red ones, which are steroids. Steroids are a very strong anti-inflammatory. I love them for many reasons, but we do know the two risks of steroids are cataract and glaucoma if the steroid is used long term. If a patient, we can't find anything else to work, we will use steroids, and we will check the patient's pressure about every month. If there's any history of glaucoma, steroids usually cannot be used. So the goal of all these natural and other products are trying to keep you away from steroids as long as you can, but we do not want anybody to lose hope because we have definitely options that do work even without steroids. Okay, the fifth treatment is doxycycline. That's a pill that's an anti-inflammatory that's taken by mouth. The best is 20 milligrams per day. You do not need 100 milligrams per day. We don't want the antibiotic effect of doxy, we want the anti-inflammatory effect. You can't get pregnant on doxy and you can't be in the sun, so if you're gonna go to Miami, you come right off of it. Doxy works generally very well because it's excreted for the oil glands in terms of keeping those glands functioning, but some people will try and say it didn't help. I've had 2 patients in my entire career that have had either a yeast infection or a UTI with doxy, which I don't know if it was from the doxy, but it's really rare. The punctal plugs is number 6. It's one of the rare things covered by insurance. It's a little cover, there's a little drain here in the corner of the nose that goes to the nose. It's from the eye to the nose, or the outside of the eye to the nose, I should say. And we can put a little cover so the tears stay in the eye longer. So it's basically meant to keep your tears in the eye longer. So it might help patients save money from artificial tears, or keep the tears or whatever we use in the eye longer, whether it's serum or platelet-rich plasma drops. The downside is that if you have a lot of inflammation in the eye, it can make the symptoms worse. And there's 4 locations to put them in. Sometimes the only way we'll know if you'll like it is by trying it. And some people cannot live without them. They'll come back if they pop out. That's the #1 complaint with punctal plugs, is they just pop out, so they feel great, and then a few days or weeks later or months, the symptoms come back because the plug is falled out. It's really rare to get an infection, but it can happen. The risk of it getting stuck in the canal and needing to be surgically removed is extremely rare. I maybe have seen 1 case in my entire career, but it's very rare. So those are very safe. And I would have that done on me for sure because it's very safe and it is covered by insurance. Okay, so number 7 are the ones I mentioned to save the glands. LipiFlow is the most commonly performed method. Number 8 are the steroids. We try to stay away from them, but if we need them, we go from lowest dose to highest dose, and there's many kinds of steroid. Lotemax or Alrex, they usually come in a pink top. I think I have one here, this is Alrex. And we just start with the lowest. If not, we go up to the highest, but usually that is rare that we need that. Number 9 is conjunctival chalasis, which we'll take a look at. That's usually due from aging or chronic rubbing or chronic allergy. It means the clear covering of the white part of the eye has formed folds, and it makes the tear film unstable. So it means the tear film evaporates too quickly. And in some patients, we have to treat that to try to flatten the clear surface so it connects to the white part of the eye. So it's the conjunctiva, which is a clear part like saran wrap, that can get folds on the outside of the white part of the eye called the sclera. And we use an argon laser to basically make these microscopic little kind of thumbprints or tacks that tack the conjunctiva back to the sclera to try to smooth out that surface. If the laser does not help, and sometimes we need a few sessions with the laser, then we will actually excise this tissue and put down what's called amniotic membrane, which is basically a tissue that comes from the placenta of a newborn baby. It's the same tissue that heals the baby in utero when the baby has surgery. So when a mom is pregnant, has surgery on the baby in utero, the baby is usually born without a scar because the amniotic membrane can actually heal the surface tissue of the actual skin, so there's no scar. So that's what amniotic membrane has been used now for years for us as well. So we will put down the amniotic membrane to cover up the area that was irregular on the conjunctiva. Okay, number 10 is autologous serum. That's where we draw your blood. We take the clear part of your blood, use it as a tear. It's clear. It's usually 6 to 8 times a day. It is basically non-preserved. We start 20% dilution. Some people will need 50% or 100%, but most studies and most people do really well on 20%. We usually do a 3-month supply here, so it lasts for 3 months. You'll get these tiny little bottles. They're all non-preserved. You put them right in your freezer, and then every week you put one in the refrigerator and you use it and then throw it out. My experience has been that the majority of patients love their autologous serum. The majority of patients get better with autologous serum. There are some patients that do not get better, and we need to go on to the platelet-rich plasma drops. But if you were to compare autologous serum to Xiidra, which no one has done a study yet, I would bet my money that actually autologous serum would do better because it doesn't burn, it doesn't sting. Most people feel better within a week or two. So I would recommend that for anyone that has any type of autoimmune disease, or if Xiidra is not covered or Restasis is not covered. Xiidra can cost $600 a month, and the autologous serum is much less expensive than that. So consider that as well. Platelet-rich plasma drops we've now used here for the last few years. It's working very well. It's just more expensive for less amount of drop. So we will use that if autologous serum is not working. And again, we try 20%, 50%, or 100%. We have used autologous serum and platelet-rich plasma to insert into the glands of the meibomian gland after probing to try to regrow the glands in about now, I think about 20 patients. So it's been going very well with that to try to help the symptoms and improve the gland, the structure and the function. Number 13 is the Procera and amniotic membrane, like we talked about, number 12 and 13. So the amniotic membrane comes in a contact lens. It's a company called Procera. That works very well to heal surface dryness. It's just not comfortable. That contact lens ring can be very uncomfortable for about 5 to 7 days. We leave it in for as long as we can so that membrane will be absorbed by the body. The membrane is full of cells that will heal surface damage, so we do use it for that. In patients that cannot tolerate the contact lens, we actually will use fresh amniotic membrane, and we'll either glue it onto the whole surface of the eye and then put a bandaged contact lens. We've had good success with that. 14 is testosterone cream, 3%. I've had a lot of patients that love this. It can be a little pricey and some insurances won't cover it. Really no side effects so far, so that's an option as well. If patients are really not getting better, scleral lenses have also been shown to help. So we will recommend that if needed, and one of our optometrists does fit for that. If nothing is helping, we have now moved to cord blood serum, which is number 20. That has been, in a way, a lifesaver for the last 6 patients that we've used. One patient that had terrible autoimmune disease did not get a cure with it, did not feel 100% better, but she did say that was the only thing that really helped. The other patients have used the word miraculous to describe cord blood serum. It is not FDA approved. It is coming from a newborn baby. It has all the risks of any type of product coming from another human being, but it's been very, very effective, and it really has helped a bunch of patients really have hope and not feel this desperation and suicidal thoughts. So that has been a real game changer. We have used number 18, which are gabapentin, GABA, naltrexone. All these pills are trying to help with the neuropathy. Neuropathy means that the nerve layer, nerve fibers of the cornea, and even the trigeminal nerve and parts around the eye are firing, even though we don't see any signs of dryness, and it can be very frustrating. It's called pain without stain, and it can be very frustrating because the doctor doesn't see any dryness, but the patient is having horrible pain. So sometimes we'll need to use pills for that. The pills have positives and negatives. They can help, but they can have the risk of nightmares. In some patients, there's been suicidal thoughts with the pills, so that has to be followed with either a neurologist or a PCP doctor as well. Okay, and then number 17 is things like steroid pills. It's really rare we need to go to this, but it's on the list, and some people do need that. Number 18 has not been FDA approved yet, but it's trying to help with the 3rd layer of the tear film. You know that there's 3 layers of the tear film. The lipid layer is the meibomian gland producing the fatty layer. The aqueous comes from the lacrimal gland here, that's the watery layer, and there's a surface cell on the surface of the eye that has goblet cells that produce mucin. We have no way to image that easily, so it's been very frustrating to kind of tell people how they're doing with their mucin layer or lacrimal gland and aqueous layer. But this new product, which hopes to come out in 2020, is going to try to help with that, so we're waiting for that to be FDA approved and available. Number 18 is Oxervate. It's nerve growth factor for neuropathy. We've had a lot of success with Oxervate. It's been lovely. It is a $97,000 6 weeks for one eye treatment, so it's incredibly expensive. I suspect that if you were to do Oxervate and PRP, I wouldn't be surprised if they're equivalent because we've seen such good effects with the PRP drops also. But Oxervate is sponsored by a company, and it's basically nerve growth factor, so it does work, but it's very expensive. TruTear is a nasal lacrimal probe that goes in, it's metallic, it stimulates, it buzzes basically the nerve that causes tearing. So if anyone has any aqueous loss of their from their lacrimal gland, meaning the Schirmer's test, that little strip test that we do on our consults, is less than 10, even, you know, especially less than 5, the TruTear is actually not a bad idea because it will keep that tear production going from the aqueous. It will stimulate tearing. So we have a lot of patients that have, I wouldn't say a lot, I would say I have about 5 patients that have really notice an improvement. And so it's something to consider. The cost of that, I think, is about $950 to $1,000, but it's a machine you take home, so it works well for that. And it's really very helpful to get the tears flowing. Okay, last cord blood serum I mentioned has been wonderful. Lid tarsorrhaphy and pain specialist or pain pump, those are the last two. So we haven't had to do that just yet on anybody. So there's a lot of hope. Please keep in mind that this is the best time to have dry eye. I do tell people, do everything you can to make sure you've been blinking, which I should have mentioned at the beginning during this video. Just listen to me. Talk with your eyes closed, type with your eyes closed. Every time you wash your hands, wash your eyes. Minimal screen time. Use your eyes or contact lenses for eye-worthy things, contact lens-worthy things. The less you use the computer now and contact lenses, the longer you'll be able to do that. So please keep all these treatments in mind. Please do not lose hope. If you have dry mouth or arthritis, please let me know. Please keep in touch with my Facebook page. You can see some of the other options that are available. I do post on this weekly so people will know what's updated and available. Thank you for your time, and then I'll answer any questions you have when I see you in consultation.